Dr. Sinanan here, and today we're going to talk about stroke. Now, loosely defined, a stroke would be the death of brain tissue. The same way in a heart attack where you have death of heart tissue or heart muscle, in a stroke you have death of brain tissue. And there are two general mechanisms by which this can come about. So, let's say this is your brain here. Okay, and of course the brain has its own blood supply. Let's say that's the blood supply to the brain. So the blood vessels. Let's say now there's a blood clot that forms there. Okay, so the blood clot forms there. So it means all of the tissue forward of this blood clot are going to be deprived of blood. And then if they're deprived of blood long enough, they die and the person gets a stroke. The next mechanism could be a bleed or hemorrhage. Let's say this blood vessel here ruptures and bleeds. Then again, all the tissue ahead of this bleed are going to be deprived of blood because instead of the blood flowing this way, it has now bled out. And all of the tissue ahead of that are going to be deprived of oxygen. And again, if deprived of oxygen long enough, they are going to die. Okay, so blood clot would be an ischemic stroke. A bleed would be a hemorrhagic stroke. Okay, so those are some technical terms that you may see on an MRI or a CT scan. The TIA, what is called a transient ischemic attack. Now, the word transient, this means short-lived. Now, in a transient ischemic attack, this is where a person experiences the symptoms of a stroke, but for a very short period of time, and they recover. For example, for a few seconds, a person may get some slurred speech. All of a sudden, the arm goes weak, but then it recovers strength. What is going on there is that you are getting a temporary blockage of a blood vessel here that is resolving. Okay. Now, the issue with that is not a benign situation, and that is something to be taken very seriously, because a transient ischemic attack can then evolve into a full-blown blood clot in the brain or lead to an ischemic stroke. Okay. So I just want to bring that to your attention. Just because you are recovering quickly, that doesn't mean you are okay. That doesn't mean you are in the clear. That does not mean that there's nothing to be done. Okay, this is not a watch and wait situation. You need to get this checked out as quickly as possible. Causes of stroke or risk factors for someone getting a stroke. First, on the list here, we can talk about diabetes. And with diabetes, again, so if you have diabetes, the blood vessels of your brain will be affected. You will have narrowed blood vessels, poor quality blood vessels, and then this again increases the risk of you getting an ischemic stroke or a blockage of an artery within the brain that then leads to a stroke. High blood pressure. Now, remember the physical structure of a blood vessel, it is limited. It has limits. There's only so much pressure, blood pressure it can take safely. So if you have high blood pressure, what this can do, it can lead to a rupture of the blood vessel. Okay, so you have a rupture of a blood vessel due to high pressure, you can end up with a hemorrhagic stroke or a bleed to the brain leading to a stroke. High cholesterol and atherosclerosis. Now, if you have this condition here with the atherosclerosis, let's just take a cross section of a blood vessel here. Let's say this is the diameter of a regular blood vessel. With atherosclerosis, you have the plaques, the cholesterol plaques that gather within the blood vessel. And as you can appreciate here, now there is less room for the blood to flow. Again, so this increases the chance of you receiving a reduced amount of blood to the brain, and which can then lead to a stroke. Additionally, too, as well, you can have rupture of the plaques, which then lead to a blood clot that then blocks off the blood supply to that part of the brain, leading to a stroke. A lack of physical fitness. Remember, when you exercise, the quality of your blood vessels improves. It also improves your blood pressure. So lack of physical fitness can lead to poor quality blood vessels, narrowed blood vessels, greater chance of high cholesterol, atherosclerosis, uncontrolled pressure, or high blood pressure. As well, too, if you are diabetic, you are likely to be less controlled if you are physically unfit. Okay, so lack of physical fitness leads to a myriad of conditions that then increases the chances of you getting a stroke. Aneurysms. Now, what is an aneurysm? Okay, so let's just say this is a regular blood vessel here, normal, healthy blood vessel. With an aneurysm, let's say the blood vessel has a weakened portion on the wall, and then it bulges out like that. Okay, what happens is this aneurysm here, or this bulge here, it can rupture, leading to a bleed to the brain, which then leads to a stroke. Okay, so that's another risk factor for someone getting a stroke. So now we're going to talk about the treatment for stroke. Okay, so persons had a stroke. Now they were attended to by a medical facility. They've been discharged. Okay, so if you go to a medical facility, nobody gets a stroke out of the blue. There's always some sort of risk factor, whether the person has some sort of pre-existing medical condition, or maybe they had a poor lifestyle. So in terms of the medical treatment, what happens here is that you would be at least started on some sort of medical regimen to deal with your comorbidities, right? Yes, your comorbidities could be things like diabetes, high blood pressure or hypertension, heart disease, cholesterol issues. Okay, right. Well, this is just the basics. Okay, but so once again, the medical regimen, the traditional medication given, would have to deal with the comorbidities, because, like I said, nobody just gets a stroke out of the blue. There's always some risk factor, something happen for a person to get a stroke. Now, physical. In terms of the physical, what I really mean here, it's therapy. Okay. Because when you have a stroke, what happens is that there is, remember, you will have a loss of limb strength, whether it's on the upper limb, both the upper limb and the lower limb. Okay, either the left side or the right side. There would be maybe some blindness, slurred speech, loss of memory, difficulty thinking. But I just want to focus right now on the physical aspect, the loss of strength, the loss of coordination. So in terms of the physical treatment, you're going to have to do therapy, and therapy should be started as soon as possible, even recommended if the person is willing and able to do the therapy while on the ward at the medical facility. That can be done, provided bedside therapy is provided or is available. Okay? What you don't want to let the person not use the limb for too long, because then you're going to get a worsening of the strength, or worsening of the lack of coordination. So you need to start this physical therapy as quickly as possible, as quickly as it is safe for the person to do so. And then there's the lifestyle changes. So this ties back into the comorbidities. If you realize these here, most of them here, they're really lifestyle diseases. So what in that person's lifestyle caused them to have all of these risk factors here? Was it poor diet, lack of exercise, high stress? Okay, so we have to, lack of sleep as well, right? Poor sleep done chronically is going to set you up for these comorbidities, diabetes, high blood pressure, heart disease. Okay, so lifestyle changes then have to be made. If a person was not eating well, was not exercising, was in a high stress environment, yes, the person may be on a medical regimen. For the medical regimen to really work, to get the maximum effectiveness, the lifestyle factors need to be sorted out. Okay, so generally we can think medical treatment, physical treatment, and the lifestyle changes that need to be made. The symptoms and the complications of a stroke. Okay, so when there is a stroke, remember there is a loss of brain tissue, which means certain functions will be lost. So one of them could be blindness. Again, it all depends on which part of the brain is affected. Okay, so blindness can be one of the symptoms of stroke. Person can have slurred speech. All of a sudden, the person is speaking to you, they're speaking normal, and all of a sudden, they have difficulty speaking. The word becomes slurred. Okay, slurred speech, dizziness, that loss of balance as well. Right. So in the process of a person getting a stroke while interacting with someone, or even by themselves, of course, they may experience dizziness, loss of strength and coordination. The person can report that all of a sudden there was a loss of strength in the arm. All of a sudden they couldn't walk, they lost their balance. Okay, so loss of the strength and coordination in the limbs, again, is one of the very common known symptoms of a stroke. Contractures. So a bit later down the timeline, the person then goes to a medical facility, and now they're discharged. And let's say no therapy is done. One of the very common complications we see in terms of contractures is the upper limb. So after a while, what happens is the hand goes weak, and then not in everybody, but what happens in some certain percent of the stroke victims, what happens is bicep becomes tight, forearm muscles become tight, and the person's hand is in this position, fingers become clenched, and you're like this. Okay, this is more likely to happen if you don't do therapy as soon as possible. You just leave the limb and then just like this. At this point, it's very difficult to deal with. Okay, therapy and splints can help a bit, yes, but it's very difficult to deal with when a significant amount of time has passed and the limb is in this position. So this would be an example of a contracture leading to the limb being in this formation. Depression, of course, what is if a person has a severe stroke, or it doesn't even have to be a severe stroke, it can be a mild stroke, but once there's that loss of function, the loss of ability to care for oneself, the loss of the ability to provide for your family, of course, this can lead to depression, okay? So this is a psychological complication of stroke. Okay, so that is why it's so important for the family to be supportive, to be there to speak to the person, but as well help the person with their post-medical management, because the person needs to know that the family still cares about them. And so you need to really interact with the person. If they have doctor's appointments, please make sure that they attend the doctor's appointments. Don't treat it as something that is trivial, because then the person is going to interpret that as, no, my family doesn't care about me. So the family support, the psychological health of the person is very important. Let's now talk about the investigations in a person who's having or who has had a stroke. Of course, when if a person is exhibiting the symptoms of a stroke, you end up at the health facility, and then, okay, the doctor says, okay, I think the person is having a stroke, and the person can be carded for a CT or an MRI. The CT or the MRI will give evidence of a brand new stroke, or even a stroke in the past, okay? Because if a person is having a stroke, it is possible that they may have had a stroke in the past. Maybe it was not as bad as the one they're currently having. They ignored it, and then life just went on, but they never dealt with the comorbidities, and now they're having a second stroke, okay? That is more severe than the first one, and this one now warrants the person being in the hospital. So yeah, so the CT and the MRI will be done at the hospital, right? So when the person is being investigated and being worked up again, remember, the stroke doesn't happen for no reason. There are generally underlying factors, comorbidities, diabetes, pressure. So part of the blood work, which will fall under the investigations, looking at the complete blood count, if the person is anemic, diabetes. If the person reports that, as far as they're concerned, they don't have diabetes, they will still test and see, okay, does the person have diabetes? Is this one of the causative factors of the person having a stroke now? Or if the person reports and says, yes, I am diabetic, well, is the person controlled or not? Okay, so you have to investigate things like this. So when the person is diabetic, you want to do a fasting blood sugar as well, or a random blood sugar, because it's unlikely the person will be fasted when they reach the facility, and also the HbA1c test. Okay, we have a separate video on the HbA1c test, but it is related to the level of diabetic control. Cholesterol. Again, does the person have high cholesterol? Is the person at risk for atherosclerosis? Right, so this has to be investigated. Kidney and liver as well, because the person would likely be put on a medical regimen. You want to make sure the kidney and the liver are healthy to actually deal with the medication that the person may be given upon discharge or would be given on the ward. Okay. As well, the blood, you will want to do a blood pressure monitoring on the ward, of course, to make sure the person is not hypertensive. Okay, again, high blood pressure, it is a risk factor for stroke. Upon discharge, if a person had a blood clot in the brain, a carotid ultrasound. Now, what is this? The carotid arteries, the arteries that run right here, that's the pulse you feel when you put your hand there. Okay, and this, of course, this supplies the brain. Now, if there's atherosclerosis or narrowing of the carotid arteries here, and let's say pieces of plaque break off and they go to the brain, you can get a stroke. So, and using ultrasound, we can investigate and see if there is any narrowing of the carotid arteries that may have led to the person having a stroke. Okay, this will normally be done after discharge as a follow-up, or it may be done right there. It all depends. If the person, again, to blood clots can come from the heart. If the heart is beating abnormally, and you can't get blood clots forming in the heart, again, that leave the heart and travel to the brain. So an echocardiogram, or what is called a heart ultrasound. It's not an echocardiogram, but it essentially is an ultrasound of the heart. That's basically what it is. So investigations of the heart using echocardiogram may also be done depending on the person's status, depending on the person's medical history. This may be done to see if there's anything wrong with the heart that needs to be further followed up by a cardiologist. I'm going to do my own blood pressure because I explained to you that high blood pressure is a risk factor for a stroke. Okay, so when you have your home kit, okay, normally these things have a marker on them. Normally this dot here, this dot is supposed to line up with the center of the forearm. Now they're about 2 finger breadths away from the crook of the elbow, like that there. Okay, that's the dot. Good. Relax. Now what you need to notice here is that the cuff is at heart level. Okay, if my hand was up here, that would be an inappropriate reading. If it was down here, that would be an inappropriate reading. So should be at heart level. That is appropriate. All right, relax. Take a couple deep breaths, and you hit the machine. Okay. Preferably, you should not be talking while a doctor is doing your blood pressure. Okay, good. Right, so my blood pressure typically tends to be below the traditional 120/80. This is normal for me. I don't have any blackouts or dizzy spells, okay, and I work with on a regular basis. So my blood pressure 108/76. This is a good blood pressure, okay? So 108/76, the third number is normally your heart rate or your pulse, okay? That synchronizes with the rate that the heart is beating per minute. The 108, when your heart is contracted, that's the blood pressure when the heart is contracted. Then the heart relaxes to refill with blood. When it relaxes, that's the 76. This is typically known as your systolic pressure and your diastolic pressure. And you can see here on the machine, systolic, DIA, diastolic. And that's the pulse in rate, in beats per minute. Okay, so this is that's a general primer as to how to test your blood pressure. Good, and now we're going to do a random blood sugar on myself. Okay, so now we're going to do a random blood sugar on myself. This is not a fasting blood sugar because it's after 12, I already ate. But it's still, it does have value. Okay, so your basic setup is your lancet, your alcohol swab, what's your machine, strip, of course the needles that go in the lancet. Okay, so this goes in there. This is a clean needle. You got your lancet here. So right here, you see these numbers here. This tells you how deep the needle is going to fire into the skin. Okay, of course, number 5. You see the arrow right here lines up with 5. Okay, so that's the deepest setting. If a person has thick hands, we do a lot of construction work, and then skin is very thick. We want to use that. Small person, we want to go on to 3.5, 4. It all depends. Okay, I'll just go 4.5. So you undo the top. See it's empty. Take the needle, put it in here. You hit the click. See how that raises there? Break the top off. That's the needle. Very fine. Not very long. Put it back. Yeah. All right, let's just see if you have to make sure the button is raised. I can just do a fire. Needle, of course, it doesn't shoot out. It just goes down. Pull back on the trigger here. See how it clicks and it holds in place. This is ready to fire. Alcohol swab. Just swab your finger. Take out just one of these strips. Right, so what is here? There's a small little slot there on this part here. Here's where the blood goes. This is the top side. That's the reverse. This goes into the machine like this here. Strip is in. And now you see this blood drop. That means it's ready to receive blood. Take it, put it against the hand here. Not here really, but out to the side. Fire. Good. Use some blood there. You don't need much. Hit the beep. Let that count down. Yeah, that's a good blood sugar, 97. 97 after a meal, that's fine. So there's no concern there for diabetes. But as you see now, this is how you generally would test your blood sugar. Okay, it's all clean. It's all good there. All good. Remove and done. Okay, so now you know a bit more about stroke. You know how to start monitoring. You know how to do your blood pressure. You know how to do your sugar. Make sure you write these things down in a copybook or a notebook. Okay? If you're having any concerns, take those values to a doctor and get yourself sorted out. Okay, I hope this was helpful.